Hi, I'm Dr. Alif Musaji, the Smiling Dentist, and today I want to talk to you about consent. Consent is a big topic, and it's a really important topic because it frames the relationship we have with our patient. There's a massive legal aspect to it, but there's also an aspect which is about treating our patients like human beings who deserve to understand what they're getting themselves into before they do. And that's the bit that I really want to focus on to make sure that we are treating our patients the best possible way that we can. Consent is a slightly controversial topic, and I'm going to be slightly controversial because there is perceived wisdom about what we should do is dispassionately explain all the different options for treating the patient's problem and not recommend one or the other. But I think that's wrong. I don't really know that much about cars, but if I go to the mechanic and he tells me that there's a problem with your car and you could do this or you could do that or you could do the other, I don't know where I stand. I don't know what the best thing to do is. So normally, and this is really important, if I trust the guy, I'm going to say to him, what would you do if it was your car? And I expect him to give me a recommendation. I'd be a little bit cheesed off if he didn't. So why is it so important to get the consent process right? Because we have a legal and an ethical duty. If we get this wrong, it's very easy for the patient to turn around and say, I did not understand what I was getting myself into. So not only do we have to show the patient what they are going to have done, it's incumbent upon us to make sure that they have understood it as well. This is where some of the difficulties can come and where dentists can often fall foul if they do get referred to the GDC. One of the most important things I do is to try and frame my conversation with the patient in the right way. That way I feel like I can take control of the conversation. I frequently say to my patients that there is no perfect option in dentistry. Let's face it, there isn't. There are always some drawbacks. So I explain to them that what we need to accept is that there is compromise with everything. And it's up to us together to work out which compromise that patient is most suited to. So it's not just about throwing options out there. I feel like if I want to do my job of consenting the patient properly, I have to get to know them well so that I can recommend the right option for that patient. Remember, there's lots to discuss with patients. So my advice to you would be to tell them the stuff that's really important to tell them and try and tell them it in a really nice and simplistic way. I'm going to share a story that a friend of mine, Ashley Latta, tells on his course. He explains that, can you imagine you're on the M6, it's raining and it's cold and your car breaks down and you wait an hour and nothing, and then another hour goes, 2 hours, and finally the AA man, you see his van and it pulls up in front of you and you say, yes, finally I'm going to be fixed and good to go. He has a look, he opens the bonnet and has a look at the engine and he says, yep, I know what's going on. And then he says to you, right mate, come on into the back of my van. And you go in, you follow him and he says, okay, I know exactly what I'm going to do, but before I do, I'm going to tell you all about how the internal combustion engine works. And then I'm going to tell you exactly what's wrong with yours. And then I'm going to teach you exactly what I'm going to do to put it right. This, I'm afraid, is what dentists do every day. They educate their patients on the minutiae of the procedure that they're about to perform. To be honest, I'm not quite sure why we do it. I don't think many patients really care. It's more about maybe asking them what they need to know to feel safe to carry on, and then delivering that to them in a way that makes it easily digested and easily understood. Then crack on. I think it's really, really important to explain risks in a responsible way in order to allow your patient to appreciate what they're really getting themselves into. I don't think it's enough just to list what all the risks are. I think it's important for us to contextualize that so they understand how often those kind of things can happen. I think it's important to understand risks associated with the procedure, but also risks for having that treatment done long term, and what longevity really means and what it looks like. So important that patients understand success as well as failure. So I'll often have a conversation with them about how, for example, root canal treatment has 85% success rate. But I also remind them that that means that it's 15% failure, because people register success and failure in slightly different ways. But the last thing I always end on is to say, remember, even if it is only 15%, if that risk happens to you, it'll be 100% real. You won't take much solace in the 85% of people that got away with it. I think that really helps to hammer home the point that failure is a reality of any kind of surgical procedure. Remember that there are certain things that you need consent forms for, and certainly certain procedures like sedation, for example, that you need to get signed consent. But consent is a process. Consent is the conversations that you have with patients, and it's really important that you, or even more helpfully, if your nurse can be writing, making a contemporaneous record of the conversation you're having, and making sure that the most important points like risks and costs and things like this have been discussed, then you can demonstrate that you've had a responsible conversation with your patient and really let them into your world so that they're able to make the right decision for themselves. I think it's so important to build rapport around dentistry so that you have the opportunity to get to know your patient before you advise them or recommend any treatment option. Some patients have got different attitudes with respect to how comfortable they are having procedures done. Other patients have got deeper pockets than others. So it's important to take all of these things into account, because then you might say, I think the right option for you is an implant. Or you can say, well, actually, I don't think the right option for you is an implant. I think you'd be better off with a denture. It's about understanding what makes your patient tick so that you can recommend the right treatment modality for them. I find that if you've done that well, and obviously, I'm not saying that you must hide the fact that there are other options. You must mention them, but recommend with a clean heart as well, so that you're able to stand up and say, I recommended the treatment for the right reasons because it was the right thing for that patient, not because it was the most expensive treatment and I wanted to make a quick buck. And if you found that video useful and you'd like to see more, remember to like and subscribe.